Hello friends, it's Victor here, and I want to talk about doing top surgery recovery without pain meds. At this point, I'm about 2.5 months post-op. I had double incision top surgery, and I did my whole recovery without taking any pain medication. I didn't take any acetaminophen or ibuprofen. I didn't take any of the opioids that were prescribed to me, or anything like that. And so I just kind of want to talk about that a little bit, and this video is really geared towards people who either for entertainment purposes and proof of concept purposes like me want to consider doing top surgery without pain meds, or for any kind of aversion to like strong medications or opioids are considering not taking those. During my top surgery operation, when I was unconscious under general anesthesia on the table, they actually injected me with some local anesthetics, including Exparel, which is this new drug that came out, I think, in the last couple years. That is supposed to help a lot with post-operative pain. And so I can't say I didn't take anything, but I didn't have any control over whether or not they gave me that anesthetic. In those first few days after surgery, I felt great. Like, I did not feel really any pain at all. I felt like discomfort and like a little bit like gross because I was dirty. But other than that, I didn't feel like acute pain. I didn't feel any like numb pain or anything like that. It was mostly just like the discomfort of being in this compression vest with like the drains like coming out and rubbing against your skin. Like, that was literally it for the first couple days. On day 3 post-op, that's when the Exparel wore off. And so I was no longer having the pleasant effect of not being in pain due to that drug, and at that point was considering potentially taking the opioid that was prescribed to help manage the pain, or was also considering just toughing it out and seeing how it went. I opted for the second option and decided to just kind of let it play out and see how uncomfortable I got, and see if it got to a point where it was unbearable and I needed the pain meds. And really just after a day or two, it kind of became a game with myself of like, oh, can I just do this whole recovery without any of the pain meds? The answer is yes, I did. It was great. And now it's just like a fun thing I can talk about. So at day 3 post-op, I was in a considerable amount of discomfort. At this point, the Exparel had worn off. That's the stuff they gave me when I was on the operating table. And I really started to feel the drains digging into my sides. Like, I could feel every time I would like move my arms, or every time I would like twist or turn or like put pressure on one side or the other, it would just be very, very uncomfortable. And I could feel that there were things coming out of my body and that they were pressing up against the sides of my chest as well as against my arms. And that was just generally unpleasant. Now, there would be the occasional time where like the drain would like accidentally get pulled or something like that, or I would like accidentally put too much pressure on one side, like if I like turned over or something, and then would immediately go back to like not having that pain there. But that is the only acute pain that I felt, was really all related to the drains, and where the drains were contacting my body. The vast majority of the rest of the pain that I was feeling was really, how do I describe it? Like almost bruised, or sore, in a way, like muscle sore, like skin to the touch sore, and also kind of bruised is a good way to describe it. And so to me, that was not really worth, you know, taking the opioids for, I guess. Like, I felt like it was manageable on my own. And like I said before, I didn't even take ibuprofen or acetaminophen. So there were like other things that I could have taken to like help with that, but I really didn't feel like I needed any help with managing that pain at all. So that level of like low level, like general area discomfort persisted for maybe the first week or two after surgery. And then after that, it was like, no question, like don't even need to consider thinking about any of like the pain management stuff. I just like felt fine. The one event where I felt like, maybe I should have considered taking pain meds for this was when I got the drains pulled out. That was at 6 days for me and was extraordinarily unpleasant. Definitely the most unpleasant part of the whole recovery experience. At that point, they like took off all of my compression garments. They like took off all the tape and stuff. And then like really it was just a 1, 2, 3 yank to get the drains out. Did I get my drains out at 2 weeks or 1 week? I actually don't remember now. Whenever they took out the drains, it was horrible. That was acute pain. I felt like like the site where the drains were going in, like on the skin surface, felt very, very stingy. And it felt kind of sore and painful. And then on the inside, I could kind of feel it coming out a little bit, but it really wasn't as bad as the surface of the skin on the sides. That was the really painful part. And it felt very strange and just like really uncomfortable and unpleasant. And like acute pain, like to the surface of the skin. And so in retrospect, had I known it would hurt that much, I probably would have gone ahead and taken the opioid that I was prescribed. Just because I think that would have made that experience less unpleasant. All in all, I would say that my recovery was relatively smooth and that I did not have huge issues with being in pain or discomfort. I'm also kind of someone who likes to be rugged and like I can deal with being uncomfortable. Like I'm a backpacker and a caver and like all this stuff. And so I'm kind of used to like not having all of the creature comforts in life. Just by choice. And so that's like a-okay with me. Also, as a side note, of course, everyone is going to be different. And depending on your body and your surgeon and how well you were prepared ahead of time and how well your body is recovering and healing, you might be feeling different, like worse or better than I did or than anyone else did. And so just take your own individual situation into account because of course, not everyone heals and recovers the same way for a variety of different reasons. Now, I will give the disclaimer here that I am someone that generally heals very quickly and very well, not in terms of like aesthetically, like my scars are still here at 2.5 months. They are very red, very, like almost purple in some places. Like they're very, very dark, but I don't feel any pain. And so in terms of how I feel, I am someone who recovers very well. Just for a little bit of context for that, I got my wisdom teeth out yesterday. And so, like, obviously I'm talking normally and I'm not really super swollen. I do not have any pain at all whatsoever. I didn't have any pain really at all. I had a little bit of discomfort and took one of the narcotics that they prescribed me just to sleep that first night. But other than that, like, have been totally clean on, getting my wisdom teeth out. And so, and I feel like, you know, I'm still being careful and eating soft foods and things, but I feel like I can eat normally more or less at this point. And like brush my teeth and all of that kind of stuff without any like painful consequences. And so obviously a lot of different people have a lot of different experience with like their wisdom teeth and how well or poorly that goes. But for what it's worth, my wisdom teeth thing went really, really well. And so I'm just someone that recovers well from things. So take my top surgery, like recovery stuff with that as the context, I guess, just to be aware that I recover well. My overall general thoughts on this would just be take the pain meds if you feel like you need them. If you feel like they will help you, then do that. If you're scared of them or want to do a proof of concept thing like I did, then don't do it. Totally possible. But again, listen to your body. And if you're in excruciating pain, please take the pain meds. They're there for you to help you. So you should take them if you need them. But yeah, in my opinion, totally doable. And really after the 2-week mark, like I did not even think about taking ibuprofen or anything like that. Like I felt totally fine after 2 weeks. Like a little bit like, I don't know, antsy and like muscle sore from not having moved a lot in 2 weeks, but you know, felt totally fine in terms of needing to take painkillers. And I think that's a relatively common experience. Like I've heard a lot of people also say that around 2 weeks they felt like pretty fine. So if you're trying to like stick it out or whatever, maybe like have that as a goalpost, if you will, I guess. It gets better every day, in my opinion. Like, every day I felt a little bit better, other than those first 3 days when I felt, like, great because I was on other drugs. Long story short, totally doable if you want to do it. You also don't have to do it. Alright, that's all I've got for today. Please consider liking and subscribing for more content, and until next time.